21 Nursing Problems Theory and the 4 Nursing Metaparadigms. Introduction. This paper aims to define and explain my beliefs and thoughts about the 4 nursing metaparadigms and their correlation with the 21 nursing problems theory proposed by Vægter and Abdallah. The primary factor that has influenced the development of my nursing philosophy is the study of existing approaches to care and their correspondence to the values I apply to all aspects of my life. I have also analyzed the determinants of patients' satisfaction with care to identify the most effective approach to treatment. The essay provides a detailed overview of the environment in the nursing metaparadigm, the person, health, and nursing concepts. The paper's main idea is that nurses should implement a person-based approach and use all available methods to ensure individuals' physical and mental well-being. For nursing metaparadigms. Nursing metaparadigm, person. The 4 nursing metaparadigms present the basis and the essential elements of nursing practice. They can be identified as a person, environment, health, and nursing. My primary belief based on the person metaparadigm is that patients should be treated as individuals with a primary focus on their desires and concerns, rather than their conditions exclusively. To me, it means that their needs should be valued and considered while making clinical decisions regarding their health. For example, a caregiver should analyze the cultural and social backgrounds of patients to be able to meet their expectations and understand their fears regarding care. Moreover, when patients feel irritated, uncomfortable, or vulnerable because of their conditions, nurses should prevent these feelings from occurring by dedicating their time to individuals and showing a positive attitude towards them. Environment in nursing metaparadigm. The environment metaparadigm also plays a significant role in my perspective of nursing. I think that the environment is crucial both for patients and for caregivers to ensure their physical and mental well-being. Individuals should feel safe in the hospital setting, which should be designed in a way that helps to reduce people's anxiety and stress levels. If possible, a nurse should arrange patients' access to nature, including taking them for a walk or opening the window to provide fresh air and natural lighting. I believe that caregivers should establish the environment according to people's individual needs, as it might guarantee a faster process of recovery. Metaparadigm of health. As for the concept of health, I believe that nurses should use all of the available sources to ensure that a patient's recovery process is fast. It is clear that caregivers should use a variety of skills in their work. They should have clinical knowledge and be able to provide psychological support to improve individuals' conditions. Moreover, nurses can apply alternative approaches to their practice. For example, they can use the elements of the holistic approach to improving patient outcomes. For example, they can promote the benefits of yoga or mindfulness for reducing pain and emotional distress. As a caregiver, I try not only to concentrate on the treatment of physical illnesses but also to address patients' mental states to improve the outcomes of their conditions. Metaparadigm of nursing. Finally, my primary thought on the metaparadigm of nursing is that caregivers should be dedicated to assisting patients not only physically, but also mentally and spiritually. Unlike physicians who might not have enough time to establish deep connections with patients, nurses' responsibility is to provide the whole range of care, considering an individual as a whole and ensuring that all aspects of his or her personality and health are addressed. Nurses should approach their work professionally, by providing high-quality care and serving as patients' advocates. I also think that nurses should be able to lead individuals through the process of recovery, helping them to establish self-care and self-assessment practices. 21 Nursing Problems Theory. The nursing theory that correlates with my philosophy is the 21 Nursing Problems one suggested by Vægter and Abdallah. The primary idea of her approach is that care should be not disease-centered, but patient-centered. Abdallah encourages medical professionals not to apply standardized practices and concentrate on individuals' needs instead. She suggests the issues that affect nursing practice, including the interconnectedness of social problems, the impact of racism, poverty, and poor education on individuals' health, and the education of nurses. The primary reason why my philosophy of nursing correlates with this theory is that it also considers the safe patient environment, individuals' mental health issues, and their social and cultural backgrounds as crucial elements of treatment. The theory also correlates with my belief that it is necessary to utilize a personalized approach to treatment and that the development of nurse-patient relationships is vital for effective care. Conclusion. The 4 nursing meta-paradigms are key as they provide the structure for caregivers' practice. My primary belief regarding the concept of a person is that nurses should focus on individuals' needs while providing care, assessing both their mental and physical conditions along with other factors, such as cultural background. As for the environmental meta-paradigm, I think that establishing safe and comfortable settings is crucial for the process of patients' recovery. As for the concept of health, nurses should use all of the available assets to maintain the individual's well-being, including providing psychological support or utilizing a holistic approach to care. My thought on the meta-paradigm of nursing is that nurses should consider an individual as a whole and establish deep connections with each of them as, unlike many clinicians, they often serve as patients' advocates. I think that my beliefs correspond to Abdella's nursing theory as she also prioritizes patients' needs and promotes the idea of accessing all aspects of individuals' lives in care.